I am Dr. Sharjeel and you are watching my YouTube channel. If you like my videos, don't forget to subscribe my channel. Now let's solve this challenging case which I posted a few weeks back, and I got lot of comments. Like Izzat commented that a differential diagnosis could be superficial punctate keratitis, acanthamoeba keratitis, nummular keratitis. Himanshu Singh called it a coarse herpes punctate epithelial keratitis. Maqsood Maula called it nummular punctate and stromal keratitis, again of herpes simplex variety. S.N. Joya called it epithelial Rees-Buckler corneal dystrophy. Rachda Suleimani called it central corneal dystrophy and Meesman's corneal dystrophy. HMR called it bullous keratopathy. So I got a lot of response. I'm thankful to all the viewers who took time from their precious schedule and commented. So we'll dissect it. First of all, whenever you get a challenging case, you should identify the depth, the location of pathology. Like if it's an ophthalmology video like this one, first you should identify the area of focus, whether the area of focus is periorbital region, whether lids, conjunctiva, cornea, anterior chamber, lens, vitreous or fundus. So here everyone is spot on that the pathology is in the cornea. Everyone mentioned different diseases of the cornea, mostly keratitis or dystrophies. Now what's the most obvious differentiating point between keratitis and dystrophy? Well, if you have watched the full video keenly, at the halfway stage I switched to the other eye and the disease was absolutely same. So I showed you a case of exact same pathology in both eyes. These white dot-like opacities in a dirty gray confluent cornea, and patient was 35 years old, female, who gave history that these lesions are present since childhood and very slowly and gradually increasing in size, and her vision is gradually deteriorating. So that tells you that it's a case of corneal dystrophy. Keratitis ideally should be unilateral, but post-adenoviral nummular keratitis can be bilateral but asymmetric. Ideally one eye is more affected than the other, but that will not have that much dirty cornea. There will be clear intervening spaces between the lesions, and the history shouldn't be that much prolonged. This patient vision was counting finger, both eyes, not improving with refraction. So now you all are clear that we have reached it's a corneal dystrophy case which I have presented. Now you should think that which corneal dystrophy affects the vision most. Definitely the one which involves the stroma. The major chunk of the cornea is the stroma or endothelium, which is one of the useful part. So epithelial and Bowman's corneal dystrophies are also ruled out. Now I totally agree that the lesion which I have showed doesn't come in any of the known stromal and endothelial dystrophies that we have seen, diagnosed or known, treated. It's definitely not granular or lattice as the lesions coalesce and not clear intervening spaces. So it could be a macular stromal corneal dystrophy or mixed type of stromal dystrophy because vision is most severely affected in macular stromal corneal dystrophy or some form of endothelial dystrophy. So my most probable diagnosis in this case is that it's a variant of macular stromal corneal dystrophy, and the ideal management in this young female patient is corneal grafting, keratoplasty. OCT anterior segment can clearly identify and locate the layers of the cornea involved, and then accordingly we can plan whether to go for lamellar or full thickness penetrating keratoplasty. Macular dystrophy is autosomal recessive, and history patient said that none of the family members she knows have that problem. So that also gives us idea that it is not the most common autosomal dystrophies. So if she undergoes keratoplasty, the tissue will be analyzed and we can reach to the exact diagnosis, and I'll share with you one thing more, that the corneal grafting has excellent results in corneal dystrophies, ectasias and bullous keratopathy. So you should also know that this patient have good prognosis, visual prognosis. I hope you liked this video. Keep watching my channel for new and interesting cases. Thank you very much.